Have you ever felt like something just isn't right with your body? Maybe your periods are all over the place, or you don't even get period at all for like 2 months or more. You're gaining weight without eating more. Your skin is breaking out, and no matter what you try, nothing seems to help. Well, what if I told you it could be something called PCOS, Polycystic Ovary Syndrome, an incredibly common hormonal imbalance in women, yet often misunderstood hormonal condition that affects millions of women around the world. Polycystic ovary syndrome is a common hormonal disorder that affects how a woman's ovaries work. Despite the name, you don't have to have cysts to have PCOS. What's really happening is a hormonal imbalance that affects how the ovaries work. This condition causes the ovaries to produce excess androgens, a group of male hormones, while sometimes failing to release eggs during the menstrual cycle. Welcome back to Nursing Health and Lifestyle, where you get all tips on health and healthy living. Moving on. Here's how PCOS affects your body. You may skip ovulation, meaning your period becomes irregular or even disappears. Androgen levels rise, leading to acne, unwanted hair growth, and scalp hair loss. Many women also develop insulin resistance, which can lead to weight gain and increase the risk of type 2 diabetes. How common is PCOS? PCOS affects around 1 in 10 women of reproductive age, but many cases go undiagnosed. It can start soon after puberty, or later, especially during weight gain or pregnancy. Let's talk about the signs you see in PCOS. Symptoms of PCOS can vary from person to person, but common ones include irregular or missed periods, heavy bleeding during periods, acne, especially on the jawline or back, facial hair or body hair in unusual places, weight gain, especially around the belly, thinning hair on the scalp, fatigue, dark patches of skin under the neck, arms or groin, mood swings, anxiety or depression, and for some, difficulty getting pregnant. What are causes of PCOS? The exact cause of PCOS is still unknown, but several factors may play a role. Genetics. If your mother or sister has PCOS, your chances increase. Insulin resistance. High insulin levels can trigger your ovaries to make more androgens. Inflammation. Low-grade inflammation has been linked to higher androgen production. Lifestyle factors. Poor diet, lack of exercise, and stress can make symptoms worse. How is PCOS diagnosed? To diagnose PCOS, a doctor looks at 3 main things: irregular periods or no periods, signs of high androgens like acne or facial hair, cysts on the ovaries, seen on an ultrasound. You don't need all 3 to be diagnosed. A blood test may also be used to check hormone levels, and sometimes insulin or cholesterol levels. Can PCOS be treated? PCOS can't be cured, but it can be effectively managed. Treatment depends on your symptoms and goals. For example, if you're not trying to get pregnant, birth control pills can regulate your cycle and lower androgen levels. If you're dealing with insulin resistance, metformin may help. If you want to conceive, your doctor may suggest fertility medications like Clomid or Letrozole. Lifestyle changes you can adopt to help with PCOS. Small, consistent changes to your lifestyle can make a big difference. Eat a balanced, low-glycemic diet rich in fiber, lean protein, and healthy fats. Exercise regularly. Walking, swimming, or yoga are great options. Get enough sleep. Aim for 7 to 9 hours. Manage stress through mindfulness or breathing exercises. And avoid sugary, processed foods that spike your insulin. Can you still get pregnant with PCOS? Yes, many women with PCOS do become pregnant, naturally, or with medical help. The key is early diagnosis, managing symptoms, and working closely with your healthcare provider. PCOS can feel overwhelming, but it doesn't define you. With the right information and support, you can manage your symptoms, improve your health, and take back control of your life. Thanks for watching. If this video helped you, please like, share, and subscribe to Nursing Health and Lifestyle for more real, relatable health content. You're stronger than you think.